Start the recording for those who can't make it tonight. All right. So just before we begin, I just want to let everyone watching know that this video discusses matters related to residents of long-term care homes operated by the County of Grey during the COVID-19 pandemic. Please feel free to share this video with others in the community. If you have a family member in a long-term care home not operated by Grey County, please contact that home if you have any questions or concerns about your person's care. So joining me on the line tonight, you can't see them yet, but we have Jennifer Cornell. Jennifer is our Director of Long-Term Care, and you'll be hearing from her in just a moment. She'll be giving you an update on some of the recent changes and things that are going on in our homes. And we also have Denna Leach. Denna is our clinical specialist. I should have looked that up first. Clinical specialist? So great. So she will be here to answer some of the questions that may come up in the Q&A. And once we get through Jen's update, we will open the floor to questions. We do ask that you use the Q&A feature on Zoom. If you're on a desktop or laptop computer, it's along the bottom. You'll see a Q&A button. If you're on a phone or tablet, I do believe it's up at the top. So we only take questions submitted by text. So unfortunately, we won't be able to take questions from anyone who was called in. But if you're not able to submit your question or you think of something after the call, you can always email communications@grey.ca and we will get back to you as soon as we can with the answers. And if it's something that is pertinent to everyone, we'll make sure we include it in our next update as well. Lastly, at the end of the call tonight, I am going to ask for your help. We are going to be sending out another survey. Just is a means of collecting some feedback for our staff to help boost some morale as we're headed towards the finish line, or at least it's in sight. But I'll get into that a little bit more later. So if you're ready to go, Jen, can I pass it over to you?
Yep, I'm ready. Thanks, Rob.
All right, thanks.
Okay, great. All right, good evening, everyone. So I'll bring my notes over in front of me here and get started with the update. So as Rob said, thank you for joining us this evening. Rob introduced me already, and we support the 3 Grey County long-term care homes, Grey Gables in Markdale, Lee Manor in Owen Sound, and Rockwood Terrace in Durham. So we met last virtually on February 16th. I can't believe that a month has gone by already. Since that time, there does continue to be further directive updates from the province, the Ministry of Long-Term Care and Public Health. Infection control, staffing, and PPE strategies continue within the homes. Grey Bruce has moved into level green for public health strategies and restrictions, and we'll talk about that a little bit later. While the number of cases remain low in our region, there have been variants of concern identified, and we are hearing that we may be at the beginning of a 3rd wave. All of our residents are fully vaccinated, having received both doses of vaccine, and staff and DCPs, designated care partners, have received first dose, and we've had a very good uptake in vaccine acceptance. So staff vaccination rate is 70%, while the reported provincial average for long-term care is closer to 50%. So we're really pleased with people's willingness to learn about and then make the decision to take the vaccine. As of today, there are no cases of COVID-19 in either residents or staff at any of our 3 care communities, and there are no long-term care homes in outbreak in Grey Bruce that I know of at this moment. The purpose for our call tonight is to provide an update and reassure you that we are doing everything we can to keep your loved ones safe while continuing to color it for them every day. For this call, we have updates on vaccine rollout, rapid antigen testing update, enhanced PPE, general visits update. We're going to talk a little bit about getting outside for some fresh air, looking to the future, and a short acknowledgement of the 1-year mark. So we are seeing the provincial numbers of cases increasing to around the 1,200 to 1,300 mark across Ontario. As I mentioned, in our immediate Grey Bruce region, we are seeing a decrease in cases with 16 active cases currently. We must recognize that there does continue to be community spread and that we have seen the variant of concern in our region. And so while the finish line is in sight, we must remain vigilant in our strategies. I usually flip through really quickly what the strategies are in place in the home, in each home. So we have active screening for every person coming in and out of the building. Staff are working in only one facility. Staff interval testing has transitioned to the rapid antigen testing. We are minimizing movement of staff from home area to home area. All staff and visitors in the home are wearing surgical masks at all times, and we've now introduced mandatory eye protection as well, and we'll talk about that in a minute. And we continue to have plans in place for in the situation of needing to isolate a resident or more than one resident, and also to quickly move into full outbreak protocols if we need to. So getting into the updates, vaccination update, we continue to work closely with our partners at Grey Bruce Public Health. As mentioned, all residents who have consented have been fully vaccinated. All consenting staff and DCPs have had their first dose, and as I mentioned, a really good participation at 70%. Public Health has updated the dosing intervals for second dose for long-term care staff and DCPs. So when you hear talk about this in the media, they often refer to DCPs as essential caregivers or caregivers. The timing for the time between first dose and second dose has been lengthened to 16 weeks. We have advocated for this length of time to not apply to long-term care staff and caregivers. However, it is a direction that's coming from the province. And so I'm not sure that there's going to be any room to make changes to that. And we will keep you posted. The good news is that there has been no extension between first dose and second dose for residents in long-term care. So all our residents have had both their doses, but as new residents move in, there is a plan to keep them into a system of getting vaccinated. So as new residents, new staff, and new DCPs come into the home, we have a process for reporting that to public health, and then they'll work with us to keep an ongoing process of keeping people vaccinated. So as soon as we hear anything concrete about timing for your second dose, if you're a DCP, we will let you know. Testing update. So I feel like we've talked about testing a lot over the last year. We received updated directives from the province last night at 10 p.m. And we will include those updated directives in the email follow-up that comes out after this meeting. The highlight from the directives are the Northern Rural Exemption no longer needs to be approved by Ministry of Long-Term Care. It can be a choice that the organization makes. They've provided clarification on the frequency of testing and clarification on the requirement for support workers and general visitors and testing. So specifically with regards to frequency of testing, in level green restrictions, we are able to test less often. However, these are the minimum standards set out by the province. The science and the research recommends testing 3 times in 7 days. And so we are going to continue with that approach. We will reevaluate the frequency of testing each time the province updates the regional color levels across the province. So they usually tell us on a Friday that as of Monday, your region will be in level green, yellow, orange, red. And so whenever they give us that update, we'll use that opportunity to do a risk assessment and determine whether we're going to change the frequency of testing. We will also consider testing less frequently once all staff and DCPs are fully vaccinated. So just to clarify, staff and DCPs are required to have a rapid test 3 times in 7 days. For staff, caregivers, students, volunteers that are only coming into the home 2 times in a week on consecutive days, or only 1 time in a week, an antigen test is required on the first day of entry only. And it is a bit confusing, but we have charts and posters at the home, and we'll be able to help support you in knowing when you need to be tested. The other opportunity that we're able to offer to support this 3 times a week being tested is we are now able to offer alternatives to the nasal pharyngeal swab. So the options for swabbing now include nasopharyngeal, deep nasal, nares, and swab of throat and both nares, and shallow anterior nasal swab. And so this is why we have, we're so pleased to have Dena join us, because those are all just nursey words. And if there's some specific questions about those options, then Dena can help support some discussion about that. Enhanced PPE, effective March 8th, we implemented mandatory eye protection for all staff, DCPs, and general visitors. We were in the planning stages of rolling out eye protection and a plan for when to wear eye protection when we had a Ministry of Labor inspection at Rockwood Terrace. The inspector did leave an order requiring eye protection be mandatory for all staff when they are going to be closer than 2 meters from an unmasked resident. And the order was to be complied with the next day. So it was a Friday, and by Saturday, it needed to be in place and fully implemented. So we have rolled out this requirement across the 3 care communities. And as it's best practice, we're requiring DCPs, general visitors, and staff to comply with the eye protection. So we appreciate that one type of eye protection may not work for everyone. So we are providing a few different options to choose one that best suits you. So I believe what we have available is like goggles, glasses, face shield, and a mask with a shield attached. And so there's a few different options that you can choose from to find the one that suits you best. So visiting, Grey Bruce, as mentioned, is now in level green of public health measures. So while this means some things are reopening in the community, we are taking a cautious approach in the long-term care homes. And we had talked about that a month ago and asked for your patience in getting the rapid antigen testing program rolled out before we started looking at general visits. So I am happy to report the teams have worked really hard in each of the homes to be able to reopen general visits starting Thursday of this week. We are using the same approach that we did before Christmas when we had the gray lockdown. So prior to that, we had indoor visiting stations set up. So those visiting, indoor visiting general visits need to be pre-scheduled using the booking tool on the website. The general visitor is required to have a rapid test. You'll also have to be screened by the screener. You'll have your rapid test. You'll be provided the appropriate PPE, and then you can attend the indoor visiting station where there will be staff available to support, but we've talked about they're there to support, not to supervise. So they'll make sure everybody's set up and then give you some privacy to have a visit with your loved one. We are asking that you arrive 15 to 20 minutes ahead of your scheduled visit to allow time for the screening and the rapid test. The rapid test does take 15 minutes to get the results. Outdoor visiting stations are a little bit of a challenge. And so we are looking at having outdoor visiting stations available. However, prior to Christmas, so in the summer and fall, an outdoor visitor did not need to have a rapid test. I may have this wrong. I'll follow up on that. But now what is required to do an outdoor visit is a rapid test. So we have sent some emails and are seeking clarity from the province around that requirement because it does seem a little counterintuitive to come into the home, have a rapid test, to go outside, to have a visit outside wearing PPE in a distanced setup. So we're trying to sort through that. But for now, we do need to follow the rules, and the rules very clearly say that outdoor visitors and indoor visitors all require a rapid test. So stay tuned for more information on that. Outings, leaves, and leaves of absence. So we are continuing to suspend outings and day trips with the exception of medical appointments and by special request. So if you have something coming up that is a special request, talk to the leadership team at the home, and they will work with you to sort out a risk assessment and determine how to best support the special request. We are getting nicer weather, and we know that people are keen to get outside, and that is easier in some care communities than others. The DCPs will be supported to take their resident outside for fresh air. So if that's something that you'd like to do as a DCP, connect with your contact at the home and just talk about how to best do that. Where's the best location? So there's gardens, there's courtyards, there's sidewalks and walkways. We do ask that you wear your PPE and that you watch the distancing rules. So if there's, 3 couples outside enjoying fresh air, you're not all grouped together in a group, that you're watching your distance. And it isn't a workaround for an outdoor visit. So if you're a DCP and you and your loved one are going outside for a bit of sunshine, we ask that you not call any other family members to come and do an outdoor visit. It just complicates things. So we are really hopeful that we're going to get to a place as we become fully vaccinated where we can loosen some of these restrictions and have visiting in a way that it was before. Looking to the future, wanted to just let you know some of the work that we're doing behind the scenes looking ahead. So what does fully vaccinated life in long-term care look like? We don't know that for sure. We are reaching out to colleagues and experts in the industry to talk about what that might look like, reaching out to our partners at Public Health. Are there opportunities to expand some of our activities so that we don't have to do activities just in one home area, that we can have folks from different wings and floors and home areas together doing activities. So we're looking into that. Out for drives and out other leaves of absence and outings. This is something that we want to work through and be able to support. And we're trying to sort out how to best approach that. It's hard to have a blanket kind of rule of thumb for outings. Outings can range in risk from a very low risk ride in the car with somebody who's been tested, the driver's wearing a mask, and you go for a drive. That's fairly low risk compared to heading out to Walmart at a really busy time of day where there's lots of people and it's just a little bit of a more risky activity. So we are working on being able to support those kinds of requests and what that might look like. And then I've also had some questions about enhancing the DCP program or expanding it to more than 2 people. So right now we are required to follow the visiting guidelines, and they were last updated December 26, and they speak to the caregiver, the essential caregiver, designated care partner program, and still are limited to 2 designated caregivers per resident. As I said, I am hoping that as we become fully vaccinated and moving towards that finish line, that the designated care partner program will be more about supporting resident care as part of the care team and less about supporting safe visiting in a pandemic, and that the general visiting rules will be such that we don't need to find a way to rotate designated care partners, more people as designated care partners. If it doesn't look like it's going that direction, then we'll look at that and see what we can sort out. And finally, I would like to take a moment to acknowledge the last 365 plus days. I've heard it said that we're all weathering the same storm in different boats, and I think that's a really accurate description. We have all experienced loss, significant change, many challenges, worry, and fear. And we've also experienced courage, generosity, resilience, partnerships, commitment, and camaraderie. It's important for us to reflect and learn from the challenges and loss, and to recognize that it's in noticing the courage and the generosity and the support That's what will, noticing those things is what will propel us through the remainder of this pandemic journey and beyond. So I urge you to take a few moments to reflect on your experience over the past year. Take some time to notice and appreciate the impact you've had in the most challenging times. And I'd like to, at this 1 year mark, thank you for your ongoing support and active participation in our pandemic planning and response. Thank you for being flexible and understanding, and also for being advocates for your loved one and for all of us in long-term care. We can all be very proud of how we've worked together with the clear goal of prioritizing the health, safety, and overall wellness of our residents, our staff, and our communities. And we couldn't have done it without you. So every month I promise that we're going to try to have a shorter update, and there's always just so much information to share. So thank you for your patience. We will get to your questions now, and I'd like to welcome Dana to the call, and Rob is going to help us with the Q&A.
All right, thanks for that update, Jen. We have a couple of questions in here already to get us started, but if you have anything on your mind, please enter them in that Q&A feature, and we'll get to as many as we can. We have until about 8 o'clock if we need it tonight. So the first question is from Michelle. How many can join a general visit? Can grandchildren be included?
So I know that grandchildren can be included, and I am just having a quick look to see if I can find in the general visitors. I believe it was 2 general visitors at a time, and a maximum of 2 general visitors per resident may visit at a time. So for now it's 2, and the province's directions say general visitors younger than 14 must be accompanied by an adult. And I think we actually updated our policy to say school-age children, and we trust, and we know that people make good decisions about who to bring along with them, and knowing that they have to have a rapid test, so they have to be willing to have the rapid test. And we had no challenges in the general visiting time in summer and fall with any issues with children. So I don't see any need to make changes to that policy.
Thank you very much. What is the date when DCPs who missed the first shot can get the vaccine?
Oh, who missed the first shot. Okay, so if you missed the first shot or have more information and now you would like to fill out your consent form to receive your first shot, connect with the leadership team at the home. So contact either the executive director or the director of care, and let them know that that's the case. And that will be part of the information we update to public health. And they've committed to working with us to create mini clinics so that we can make sure new residents, new staff, and DCPs that haven't had their first shot can get their first vaccine.
Okay, great.
And could I add, Jen, just if that DCP is of the age right now, 80 years old, certainly they can enroll within the current system that public health has on their website to sign up for vaccines. That's another option.
So sticking maybe with the vaccine questions here, if a person has had both shots of vaccine, do they still need a rapid test for a general visit?
Yes, for now, rapid testing is required whether people are fully vaccinated or not. I can say that from the update, the province speaks to a couple of specific long-term care homes that are doing, it sounds like a bit of a pilot around rapid testing frequency and what's required following full vaccination. So I'm hopeful that that's the direction we're headed, where we don't need to do testing as frequently once everyone's fully vaccinated. But for now, we're required to rapid test regardless.
All right. Is there a date for the second Pfizer shot?
I keep getting my Modernas and Pfizer's, and now I keep getting them mixed up. So if it's a resident related to a resident, all residents should now have had their second vaccine. And if they missed the second shot for some reason, then the clinical team will be sorting out how to get that caught up with public health. And for all DCPs and all staff, regardless of whether it was, and I think it was Pfizer that we got, we now need to wait the 16 weeks. So they haven't given us a firm date. And if I try to reflect on when that was, it was around the 20th, I think, of February. So it's 16 weeks from then is when we can expect to hear.
16, okay. Can homemade baked goods come into the home?
Oh, that's a good question. I was prepared for food and beverage questions, but I didn't prepare myself for homemade.
Well, I think at this time, public health is trying to avoid any potential additional risk. Like if there is some individual or very specific food, I think you want to connect with the home directly. But in terms of bringing home baked goods, it is generally avoided at this time.
Hey,
Just
thanks,
don't
Jenna.
want to have any other adverse effects.
Yeah. All right. Jennifer, why are there security personnel stationed near the screening stations at our homes?
Yes, so that's another provincial initiative. And it was originally called 24/7 security, but the name has been revised to third-party oversight. And it is an initiative to ensure that as operators, we are fulfilling our requirement to do our active screening effectively, and that we have active screening in place. So the province flowed some funding to all long-term care homes in the province to support the third-party oversight and to ensure that there is active screening happening. I'd like everyone to reframe it and think of it as a check and balance on us as the operators and not a trust issue with visitors or staff. So it's really making sure that we're doing our part to actively screen people coming in and out.
Thank you. So this question says, if we live in a red zone and we want to visit our loved one in your green zone, is there anything more you would like us to do in terms of testing, not coming at all, etc.?
Okay, that's a great question, and Dana may have something to add. All along, we have tried to keep in perspective that just because you live in a zone that is a hotspot or has high prevalence of COVID doesn't mean you're living in a way that's putting yourself at risk. So you might live in a red zone and still be very careful. You don't go out into public spaces. You always go masked. You order your groceries, whatever. So you're taking very low risk. So we trust that, and we ask that you do that little risk assessment. If you feel that you've been very low risk, even though you live in a red or lockdown zone, that then you can come to the home. We have our screening in place to ask the right questions to help with that risk assessment. So you'll actively answer those questions. Then you have the rapid test, you wear the PPE. So we have several layers to protect and support. So if you feel like you've been at risk and have had maybe a chance of exposure, then keep that in mind and maybe think about postponing your visit. But if that's not the case, then we're comfortable with you coming and going through that screening process.
Yeah, and I would just add, I think reflecting on some of the people who were positive cases, and even we had a presentation today about a home that did go in outbreak, and reflecting on what they had done, they identified that even the most subtle of symptom, if you're not feeling the greatest and you think maybe that it is a slight headache and maybe it's nothing, but that may be the day that you don't, you delay or postpone your visit. And in addition, we've got the PPE and some of those other variables. It just, if it's been a while since you've been to the home, or you haven't been as a general visitors as we start that, ask about how to put the PPE on. If you don't know, don't hesitate to ask. It's not one thing that may be coming naturally to you, so don't hesitate. There's posters up there. Ask one of the staff members, and we can support you with that PPE. What needs to happen? What can we do to make this the most supportive and risk-free visit for both you and your loved one?
Great, thank you for that detailed answer, both of you.
I didn't know for the longest time whether the blue side of the mask went out or in, so I did ask and so we don't always know. Now we're all pretty highly informed on mask usage, but it's not something that we knew at the beginning, all of us.
Okay, just back to the DCP question. How many people will you need before public health can run a clinic for DCPs who missed the first dose? And again, any idea when that could happen? Right. Is there a threshold?
There is a threshold related to the vial of
the dose is about 6 in a vial.
Yeah, 6 or 8, right, to a vial, and but they are trying to look at geography as well. So if a couple of long-term care homes in Owen Sound are nearby and there's 6 together or 12, then they'll go to both. So public health is gathering that information and then making a decision about how to spread those doses out.
Okay, thank you. If a family has 2 residents in the same home on different floors and you have 3 designated care partners in total, can they see both residents?
Oh, now you guys are just trying to stump me with hard questions. I don't know. I want to say yes to everything. So let me take that question back. And maybe Rose, if you can reach out to Rob or I, and let me know which home, and we'll get this figured out.
All right, thank you very much. This one I think is coming to you, Dana. Can you please explain the options available for rapid testing?
Sure. At this time, we have 2 rapid test kits. And in terms of the way that we can approach and obtain the specimen, it's nasopharyngeal, and that is one that needs to be completed by a registered staff. And that is very much goes beyond, you can feel that one pretty significantly. The other one is a combined throat and both nares, and that one's the second sort of better option. Then a deep nasal and an anterior nasal. So I think that within those 4 options, ideally, because we want this sample to be as accurate as we can be, we would prefer, in terms of our surveillance, to have the nasopharyngeal, but we also recognize that some people, and we've been doing this for a while, and that there are these other options available. So again, the nasopharyngeal, which is that very small swab that goes into very deep into this area. Then their combined throat and both nares, the deep nasal, and then the anterior nasal. And we've also had the option for self-swabbing because we recognize that it has been a while since we've been doing this, and we want to ensure that we're doing what we can to obtain the sample, but also to maintain the 3 a week, as particularly for our staff we're in throughout the week, so that we can maintain the sensitivity and specificity of the testing. So I hope that answers the question.
So it does, but let's, okay. So now we're going to do the Jennifer version. So you're going to help me. So
very clinical.
Nasopharyngeal is the one that we've been doing. It's the same technique we've been doing all along. So they go all the way to the back and they count to like 5 or something, and then it's over. So then deep nasal is not quite as far, right, as the nasopharyngeal. And then throat and nares. So remind me where nares is just inside.
Yeah, just in both nares, yes. And they'll do the throat first and then the nose. Yeah, on the same swab.
Question. Yeah, I know. I wanted to know that. I'm like, the order feels important to me. And then anterior nasal, what's that one?
It is not as far in the nares.
Okay.
Yeah.
All right, so hopefully that helps. I don't know if you want to experience them all or choose one as your favorite, but what's nice is, as Dana said, the gold standard is the nasopharyngeal. It's the most effective for collecting a sample. But if a nasopharyngeal swab causes you to have nosebleeds or headaches, then talk to the swabber about what the options are.
Mhm.
All right, thank you. I don't know if anyone else listening was like tensing up as some of those were being explained, but
Well, I would say, Rob, one of the things is that we have some really good, the swabbers, as we've been calling them, have been quite amazing. I've had my share as well. And I think they, talk with them about what maybe your concerns or hesitancies, and we can work through the best approach.
all right, thank you very much. Yeah, and this question is saying that the experience, it does seem to vary sometimes on their visits, and it seems more painful from one to the other. Is that something that would be normal? Is it a technique thing?
Yeah, I think I've experienced something similar too. Yes, sometimes it's technique. Sometimes it could be, in terms of blood flow, it could be a variety of things. But sometimes there are those that definitely go right to the edge, which is a very good nasal pharyngeal swab, and also rotate as they're required to do so. Yeah, it's a bit of technique, but I would suggest that for the most part, it should be fairly consistent if you're having a nasal pharyngeal swab.
Okay, thanks for that, Dana. If we bring grandchildren, will we have a choice in test, or is one recommended over the other for them, specifically ages 11 to 13?
I think that you'd have the choice. Talk to the nurse doing the swabbing, and he or she will be able to support that. I don't know. We could look up to do a little research for what the swabbing techniques are that they're using in the schools. I don't.
They are working on very much. They've done some pilot tests as well with the deep nasal and interior nasal with the young. And you've got to imagine too. I mean, they have a smaller space, and but they've been doing. Infants have been receiving this COVID test since the beginning of this, unfortunately, but we've had to rule it out. So it certainly hasn't been the adolescents haven't been our clientele, but the swabbers are trained, particularly in each of the homes, are registered professionals who will support and talk them through it. So and they've been supportive with all of our DCPs as well as our staff. So I think your grandkids will be in good hands.
I'm not laughing at you. I'm laughing at Dale, who wants me to give examples with my visual examples of the swabbing.
Yeah, well, yeah.
So no.
I like yours, Jen. We should have maybe done a little picture too. And if anybody does want a picture of that and we want to send that out to you, we can, because there is a nice snapshot about each of the various techniques. I'm happy to share that too.
Yeah, we'll include that in the email that goes out tomorrow.
Okay, that'll explain it. A picture's worth 1,000 words.
All right, we have actually depleted our question bank here already, and I'm sure that there's more questions out there. So if you have them, please don't be shy about asking. And while you fill those in, I will maybe steal the show here just for a moment, Jen, and talk about something that we'd really like to do for our staff. Earlier on, when we started doing these calls, we gave you an opportunity if you wanted to submit a note of thanks or share a story or send a kind message to staff. We sent out through SurveyMonkey just a questionnaire where it gave you a box to do that. And we'd really love your support doing that again, because I think, as Jen touched on in her introduction, and you can very well appreciate, COVID-19 has really flipped our world on its head in long-term care over the past year. And despite all of that, our staff are still coming in and they're dedicated to coloring it for our residents every single day. And vaccines are rolling out, and we certainly have hope on the horizon that we're going to get to the end of this. But staff are starting to feel the drain more and more from the constant change and the emotional strain of living in a pandemic and working in this really heavily regulated environment. So once again, we are asking for your help if you wouldn't mind sharing some kind words or stories. I'm not sure how I'm going to put those together yet, but we'll certainly make sure that they go to staff in a meaningful way. And I'm also going to try something new. So in addition to the text comments, I'm going to share a link out at the end of the call and through the follow-up email tomorrow to a program that we've never used before called Vide. And what it basically does is it allows you to use your cell phone, the camera on your tablet or on your laptop computer to record a really short video message. These are typically used for birthday greetings. I think is kind of what they've created this service for, but you put them all together into a montage. And I'm hoping that we can share some of those heartfelt words if you would like to do that with our staff. So it's something that'll only be circulated internally. But if that's something that you would like to be a part of, when you see that go out, please do take a moment just to say thanks. So we have a few questions here. Perfect. So Ernie is asking, Jen, could you just reiterate when the second shots will be going for DCPs?
Sure. So we heard today from Public Health that the timing is being extended for second shots for staff and DCPs to the 16 weeks. So it will be 16 weeks from that late week in February, where we all got our first shot. So we know we need to wait a little bit.
Okay, thank you very much. With 2 general visitors, can a DCP facilitate the visit, or is the limit just 2 people?
So I'm all about workarounds, but I think that, well, the directive doesn't specifically say only 2 people. Well, it says only 2 people visiting a resident at a time. I think we need to stick with the 2 people at a time. I don't know if we can leave that with me. Let me talk to the teams. I don't like the idea of having to kick out a DCP because someone has a general visit. So I think we could probably find a way to work it out. The biggest issue I think we're trying to avoid is the risk of too many people in one small space. So we don't want to have 3 or 4, 5 or 6 people in a resident's room. But if they're being supported at a general visit at a designated space that's supported by staff and a DCP is there to help with the communication because the visitors are 6 feet away, I think we could probably find a way to support that. So leave it with me. It's probably one of those things that if it's a special request that because of communication challenges, we can support it. But the rule of thumb of the directive says 2 people at a time. How's that for a non-answer answer, Bob?
It was very political. Thank you, Jen. Can we, as a designated care partner, take loved ones to our home for a visit after a COVID test with no one else there?
So that is something that we're looking to get back to. Before the gray lockdown around Christmas, before we suspended all outings, with the exception of medical outings, we were supporting those kinds of outings, and we would like to get back to that. If that's something that you feel meets the criteria of a special request, then reach out to the team at the home to do a risk assessment and talk about when the right time might be to support that kind of an outing.
Okay, perfect. Thank you. We just got our first survey response, so thank you, whoever that was out there.
Wonderful.
Michelle wonders if there's a limit to the number of general visits in a week.
They are being pre-scheduled using the booking tool. So the essential visitor guidelines, the general visiting guidelines from the province suggests around 1 a week, that there should be no less than, like we can't be limiting people they have to be having 1 visit a week. So I think that we want to try to support the visiting spaces to having lots of people being able to kind of circle through the indoor space. So I don't know that we've put a hard limit on it, but we are asking that people be aware that right now, because of space limitations for rapid testing, screening, indoor visiting, window visits, stations, outdoor visiting stations, there's not a lot of space to set up 4 or 5 indoor visiting stations right now. There's 1 or 2 in each home. So we want to make sure that all residents are having a chance to use it. If you want to have more than 1 visit a week, more than one general visit a week, I'd recommend you touch base with the RFSM, the Resident Family Services Manager. They have a really good sense of how many spaces are being booked and are there additional spaces available, and they can help you out with that.
Thank you very much, Jen. So are we allowed to have general indoor visits now?
Yes, at the designated indoor visiting station. Yes.
Great. All right. I'm not seeing anything else coming in. So I will say going once, going twice. If you have anything else, just put it in there. And I will just direct everyone to the chat window. If you open that up, I have put a couple of links in there. I have a link to the booking tool for booking a visit for a general visit or other kinds of visits outside of the DCP visits, as well as links to the survey for staff appreciation and the video message. One more here from Donnie. When will outdoor visits with dips start?
DCPs. I think that's going out for fresh air. So you can start doing that now. It's nice out. If it's lovely, then go ahead and go out and get some fresh air and some sunshine.
Meg is wondering when the booking tool will be updated to include those indoor visits.
I think the tool is ready to go live tomorrow to be able to book for Thursday. I know it's a bit of a short turnaround. We were still kind of hashing out some of the details. So yeah, the booking tool will be available on the website tomorrow.
Okay, we will get that updated then, Meg. Virtual visits are still happening. Yes, that is correct. We're getting those scheduled. Oh, important one. Will the ice cream parlor open soon at Lee Manor? It is getting warmer out there.
That is a really good question. I will defer to the Lee Manor folks, and if I don't hear back imminently, we'll make sure that information gets out in the update.
Okay, thank you very much. Okay, and I think we'll take one more here and then we'll wrap it up. So just to recap, can there be more than 2 DCPs at this time?
Right, so no, at this time, the guidelines still limit designated care partners to 2 per resident. It's something that we talked about last week or this week, early this week, was we're seeing the finish line on the horizon. At the same time, though, it feels like the restrictions are actually more. So we're tested more often. Now we're wearing more PPE with eye protection. Now we're back to indoor visits and outdoor visits that are supported and distanced. So I can appreciate that everyone's feeling that way. And I think we just need to hold on through this third wave, whether it's a wavelet. Let's hope that it's just a little wave, but we're so close and we've done so well keeping everyone safe and healthy that we just need to hold on and try to see through our fogged up visors for a few more weeks.
Right, that's great. All right, was there anything else that you would like to add tonight, Jennifer, before we sign off, or Dana?
I'll just thank everyone. Oh, sorry, Dana, go ahead.
Yeah, I just wanted to say it's been a month working with Grey County, and it's been a pleasure, and it's been nice to see the families as well. So if there are any questions regarding what we talked about today, I'm happy. Jen will forward them my way. But thank you for having me tonight.
Yeah, thanks so much for your support, Dana. And I will just let everyone know, I see the questions and I hear the questions coming in about the expanded designated care partner program. And so I hear you, we're listening. We'll see what we can do to support expanding the access of loved ones to residents. And I know how hard it is. So let's see where we can go with that, and I'll take that back. And so again, I just want to thank everyone. Who would have thought a year in we'd still be having conversations about swabs with visuals, but here we are. So thank you for being engaged and for your feedback, because it helps us make sure we're doing the right thing for the residents and for the teams and for the homes. So thank you so much, and stay well and take care.
All right. Thank you everyone for joining us tonight. Good night.